My name is Jed Bell. I have a specialty in physical medicine and rehabilitation with an emphasis on pain management. I went to Binghamton University, undergraduate in New York. I went to NYCOM, which is New York College of Osteopathic Medicine on Long Island in New York, followed by did an internship as well on Long Island in New York, and then that was followed by physical medicine and rehabilitation residency in New York City as well as on Long Island in New York. Came out to Ohio and did fellowship in interventional pain management. For physical medicine and rehab, I had chosen it really because it's a good combination for me in terms of I really like musculoskeletal and the neuromuscular system. And so PM&R has that option within the physical medicine and rehabilitation realm. And so doing interventional pain management, I think, keys into that neuromuscular and musculoskeletal system that I can work with on a daily basis, and really why I chose this specialty. So my work career started in Ohio in Lancaster, and I did private practice for 12 years, and then I came to Genesis. I think listening is important when it comes to bedside manner. I think in regards to having good attention, making good eye contact with somebody, there's always the computer that's there, and I try to not overload my eyes, in a sense, on that computer and try to get back on a patient, make them feel comfortable, kind of at ease, to be able to open up to me and talk about the different issues that they may have. I think knowing a patient's goals is really important. So knowing kind of what they want. So if it's someone that's, let's say, a grandparent that wants to be able to play with their grandkids, or someone that is having a challenging time just walking because of their pain, trying to get them, let's say, back to walking might be their goal. So I want to know what their goal is, and then use that moving forward to help them the most I can. I think I hear from patients a lot in regards to, they'll tell me, let's say maybe at the end of the exam, that no one's really listened to me like you have today, for instance, or no one has taken the time to talk to me and describe my condition like you have, and so that may be something that could be different than they've experienced before, which I think might make me maybe a little different than others. In regards to procedures that I can offer, I do a lot of nerve testing, so it's called an EMG, so we can look at the nerve health overall. Also different joint injections, trigger point injections, different procedures to help with musculoskeletal pain. I also have experience in interventional pain management, and so that includes a lot of different procedures like nerve burning procedures, which are called radiofrequency, different techniques under fluoroscopic guidance like SI joint injections, epidural steroid injections, and even things like spinal cord stimulator trials. So these are some of the things I can offer. Medicine has improved over time a lot with information technology, for instance, and the electronic medical record. I think being able to read everything easily, it was always challenging to read, let's say, a doctor's handwriting, for instance. And so now it's all typed out, so there's nothing that you can't understand. And so I think that's been a big jump in medicine at this point with information technology. I think in terms of technology with helping people, there's been advances. Things like ultrasound. Sometimes we can provide certain techniques utilizing ultrasound. Certainly fluoroscopic guidance to do procedures, so we're able to use the x-ray to guide that needle to do a more effective injection, to know that we're in a joint, for instance, to be able to spot check that with an x-ray. That's been something that is newer and certainly better for patients. A lot of people have pain over time and they get frustrated with it. And unfortunately, a lot of people give up, can spend many years in pain. I think it's important for them to also know that there's a lot of options out there for them that they may not have realized, that with technology over time that have been created, And so I feel like maybe giving it another chance for them would be important. And of course, here we would hope to be able to help them find that optimal treatment for them that can help reduce their pain and increase their quality of life. So I really love waking up every day, being able to help somebody know that I can go to work and make a difference in somebody's life.